Hi guys, we're going to be talking about schizophrenia today. So schizophrenia is a long-term mental disorder that affects a person's ability to think, feel, and behave clearly. It is characterized by thoughts or experiences that seem out of touch with reality, disorganized speech or behavior, and decreased participation in daily exercises and activities. Difficulty with concentration and memory may also be present. Some of the risk factors for schizophrenia. The exact cause is not known, but it's a combination of genetics, environment, and altered brain chemistry and structure may play a role. So there's 5 different types of schizophrenia. The first one is schizoaffective disorder, which experiences a combination of schizophrenia symptoms such as hallucinations and delusions and mood disorder symptoms such as mania or depression. In order to be diagnosed, a person must have experienced mood disorders. For most of the time, they have also the psychotic symptoms of schizophrenia from when they first started having the symptoms up to the present. Catatonia is excessive and peculiar motor behaviors and decreased motor activity and engagement. Individuals in a catatonic stupor demonstrate a dramatic reduction in activity where the patient cannot speak, move, or respond. Childhood onset schizophrenia. These symptoms occur during childhood at age of 10 years or younger. This is really rare and it only occurs in 0.04% of the population. Disorganized schizophrenia or hebephrenia is when an individual may have incoherent and illogical thoughts and speech. And paranoid schizophrenia is when an individual is extremely paranoid all of the time, making it extremely difficult to complete a task. So some of the signs and symptoms. In order for an individual to be diagnosed with schizophrenia, they are to have at least one of the following symptoms: hallucinations, delusions, or disorganized speech. Schizophrenia is a disorder that is often lifelong, although the symptoms tend to improve gradually over the person's life, and many individuals who were diagnosed with the disorder when they were younger appear to have few or no symptoms from middle age on. Patients diagnosed with schizophrenia frequently also have personality disorder as well. Depression and post-traumatic stress and OCD also tend to go hand in hand with schizophrenia. Treatment is usually lifelong and involves a combination of medications, psychotherapy, and coordinated specialties care services. A treatment team for an individual may include a psychiatrist, a psychologist, a social worker, a psychiatric nurse, and possible case manager to coordinate care. Medications for individuals with schizophrenia are usually antipsychotic medications. These antipsychotic medications are thought to control the symptoms by affecting the dopamine levels. Because medications for schizophrenia can cause serious side effects, people with schizophrenia may be reluctant to take them. Someone who is resistant to take medication consistently may need to be given injections instead of taking a pill. And here's a little diagram to show the risk factors, the positive and negative symptoms, treatment, changes in your brain function, and the onset of when schizophrenia can start in most people. So the impact on exercise. Individuals with schizophrenia who participate in regular exercise are proven to show improvement in symptoms and cognitive functions. The benefits of exercise not only include weight loss and improved cardiovascular fitness, but also a reduction in risk of early mortality and cognitive decline. Exercise also has the potential to prevent or delay the onset of mental health disorders. Exercise can have therapeutic effects for patients with psychiatric disorders and specifically help control and reduce the symptoms of schizophrenia. Regarding exercise testing, there's no specific test for those individuals that have schizophrenia. The overall goal for those with schizophrenia is to meet the current ACSM guidelines. Incorporating exercise into everyday life will help eliminate the symptoms of schizophrenia. So the basic ASCM guidelines for this population, since schizophrenia is a mental disorder and not a physical. So for aerobic, you do 3 to 5 days a week for moderate to vigorous intensity. Do rhythmic, continuous type exercises involving large muscle groups. And for moderate intensity, do 30 to 60 minutes a day. For vigorous intensity, do 20 to 60 minutes a day. For resistance training, you can do 2 to 3 days a week. The intensity is 60 to 70%, 1 RM for experienced, and less than 50%, 1 RM for improving muscular endurance. Exercises include those that are involving all of the major muscle groups. Can do about 8 to 12 reps, about 2 to 4 sets. Flexibility, you do 2 to 3 times a week. You really just need to stretch to the point of feeling tightness or slight discomfort. You do static, dynamic, ballistic stretching, and try to hold it for about 10 to 30 seconds. So like I said before, there's different medications. They don't treat schizophrenia as a whole, but they eliminate the symptoms. So for the second generation antipsychotics, there's Abilify, Vraylar, and Zyprexa. For the first generation antipsychotics, there's chlorpromazine and fluphenazine. And there's also, I talked about earlier, the injections that you can give if your patient is reluctant on taking pills. So those injectable antipsychotics, they have Afify-Metina, fluphenazine deconatate, and haloperidol deconote. And these are just some of them, there's not all of them. And here are my sources. If you have any questions, just let me know. I'd be happy to answer them.